Hi, this is Dr. Vinatha Puli, Clinical Director of Obstetrics and Gynecology at KIMS Cuddles, Kondapur. Today, we are going to discuss about yeast infections. It is also called fungal infection or candidiasis. Whatever name we describe, it is when our immunity in the body goes down, we are more likely or prone to get these infections. You might experience white discharge in the vagina or a lot of burning pain in that area or curdy white. Typically it is described as cheesy discharge associated with a lot of itch, whitish discharge. Sometimes it is not very typical for all women. Some women experience itching more, some women experience burning more. Whatever it might be, there is a possibility when you have these symptoms, you might be having a yeast infection. As I said, when our immunity goes down in the body, maybe when you have a viral infection or any infection in the body, or you have recently used antibiotics, or you felt unwell in the recent past, or anything that depresses our immune system, we are more prone to get these fungal infections. So don't panic when you experience these symptoms. By the time you realize that yes, you might be having a yeast infection, approach your doctor and tell about these problems. So they might examine you, the local examination in that vagina and vulval area. Sometimes you might need a swab test, which is when the diagnosis is not very clear cut. The moment we see discharge, 90% of the time we will be able to tell it is a yeast infection or not. But sometimes there can be other unusual infections that can also give you discharge. Only in that scenarios we might suggest a swab test. But after examination, we think it is candida or fungal infection, we'll give treatment in the form of cream or ointments for itching, vaginal tablets to get rid of this fungal infection. If you are unmarried, young girl, you've never had a vaginal examinations, don't worry, we might give tablets for you to use orally. Some women will experience these fungal infections recurrently. That means more than 3-4 times in a year, you might have this problem with yeast infections. Why does that happen and what should we do? Sometimes the yeast infection can be because of unusual germs. Sometimes the diagnosis might not be right. We think it's a fungal infection, there could be a bacterial infection. So it won't get rid of by using an antifungal medications. So we need to get the diagnosis right. So that is where the swab test will help. If it is unusual fungal infections, you might be requiring different medications. But for some time or most of the time, the fungal infection comes back again and again. So it is a distressing problem, but there are lots of things we can do to help reduce the incidence of this recurrent fungal infections. The main genital skin advice that we give is always keep the vaginal area dry. When there is discharge, it is obvious that that area can get moist. So when we are using synthetic underwear, it will not absorb the infection or absorb the moisture. So the moisture tends to stay there and the wetness will increase the chance of you having the fungal infection flare. So always use cotton underwear. Keep the area dry in the sense you can use as soon as you wash the area, don't put the underwear straight away. You can wait for some time, air dry, dab dry the area and then wear. And always use loose clothes, loose fitting clothes instead of tight jeans or tight clothes. Loose fitting clothes will get the air to be keeping on flowing inside. So that keeps the area dry. So loose fitting clothes, cotton underwear and keeping the area dry and not using any moisturizers or any smelly perfumed talcs. Some people might use the perfumes in the underwear or area, which we strongly advise you to avoid. And sometimes some fabric conditioners can irritate the skin in that area, thereby increasing your chance of irritation because of fungal infection. So avoid all this and use no need for washing internally. So inside douches are also not recommended. There might be a normal flora or germs that are in the vagina that are helpful to get rid of this fungal infection. So that is the reason why we don't recommend internal washes. So the normal water to wash the area and keeping dry is all what is required. Sometimes some women will have, who wash their hair, they'll have the dandruff or something that goes and sediments in the vaginal and vulval area that can be irritating. So always try to bend your head on the side when you're washing the hair. That avoids the sediments of any dandruff or any irritants of the shampoos. So thereby we can reduce the number of times you can have the problem with fungal infections. Hopefully that should be helpful to you. But in case you find this awkward or still unable to cope, please get in touch with your doctor who will be able to suggest remedies further. Thank you.